Hi guys. I saw this thing shared on Facebook the other day. Women's Health magazine had an article called "The Dangers of Sleeping with an Uncircumcised Man," and I read the article. It was a bunch of bullcrap, and I googled Women's Health magazine and just the word circumcised with it, and apparently they do articles quite frequently of how dangerous it is to sleep with uncircumcised men and all of these myths and crazy things. So there was one article in particular about the decreased rate of circumcision lately, because it's down to like 50%. I think it's like pretty close to being even. It might even be 48%, but it has declined quite a bit. So they wrote some bogus article, and some of the facts they made were that circumcision is very safe, typically done within a few days after a baby is born. The procedure takes just a few minutes, and OBGYN will inject a local anesthetic and apply a numbing cream near the penis. Then use a scalpel to make the cut. No stats are kept on how many babies experience complications. They're rare and are usually limited to bleeding or infection. First of all, they're not rare. 1 in 117 men have some sort of major complication. And if you think about it, really every man has a complication because they're missing part of their penis. I would call that a complication. And they have a giant scar left behind. Lots of men experience pain. When they get older, the tip keratinizes. There are many things that are false about that, and complications are a lot more frequent than rare and just bleeding or infection. There are tons of complications. So that was stupid. And then they're saying that it's just they take a scalpel to make the cut. No. Actually, they take a thing, and the foreskin is actually fused onto the head of the penis until puberty. So they actually take a thing, and they have to rip the foreskin off of the head of the penis, and then they cut, and then they go around and cut. There's a couple different ways. There's the Moen clamp, which that's more like Jewish people do that. Most people in our area, they get the Plastival. That's how the OBG... I've talked to several doctors in our area. That's why I say that. They do the Plastival, and it's this bell that they put on. Once they rip it off, they put that in so they don't cut too much. And then they cut around that bell, and then that stays on for a few days. And once it's healed, it falls off. So they're wrong that they just take a scalpel. They definitely, for sure, rip the foreskin off of the head of the penis, which, I don't know about you, but that sounds pretty painful to me. And the fact that they say they use an anesthetic or a numbing cream is not always true. In most cases they don't, because it's such a quick procedure. Doing the numbing and anesthetic takes more time than just doing the procedure without that. And they usually just give them a pacifier that has sugar water on it to comfort them. The next fact that I use that term very loosely, that they made was it has health benefits. Boys and men who have been circumcised have lower odds of experiencing urinary tract infections. First of all, I've had like 15 urinary tract infections in my whole life, and it's a very easy fix. An antibiotic cures it, no problem. Second of all, that is false. As I said in my previous thing that I was going against, the head and the foreskin are fused to actually prevent bacteria and stuff from entering the penis and the urinary tract, which would, in fact, prevent urinary tract infections. Think about having something covered like this. If this is covered and I have a poopy diaper, I'm protected, right? If this is a bloody, cut-up penis and I have a poopy diaper, what do you think is going to happen? Infections. So, for sure, no. Then the next thing is possibly because removing the foreskin prevents harmful bacteria from congregating. Oh, I didn't finish reading it. Yeah, so congregating under the head of the penis. First of all, no. That's another one of the major myths, is that a lot of people think that you have to retract that. And that, if you retract it, that would increase the risks of urinary tract infections, because it would just be the same as cutting it off. You would be opening it up to all this bacteria, and there would be a wound there because if you're pulling it back, you're ripping it is fused until puberty. So you're ripping it away, causing an open wound, and that would, in fact, do that. But if you treat it properly, when intact, don't retract, only clean what is seen, you just wipe it like a finger, no big deal, then there would be no increased risk. Sorry if I'm jumbling. This gets me heated. So I'm going to continue. Cut guys also appear to have reduced rates of penile cancer. No, they don't. But keep in mind that penile cancer and UTIs in guys are both really uncommon anyways, and that's part of the reason why the AAP shy away from recommending it. Oh, huh. So then how does it have any health benefits? They basically did their work for me. I didn't even have to say any of that stuff because they go on and say how rare it is anyways. So, continuing. It can lower his and her STD risk. This gets me so mad every time I hear this. Everyone can get an STD. This is like basically, if I were a circumcised guy, I would read that as I don't need to wear a condom because I don't have the extra mucous membrane that's going to hold on to all the STIs and STDs, and I'm not going to spread them to my girlfriend, and she's not going to spread her stuff to me because I don't have a foreskin to hold all that stuff in. No, that is stupid. Everyone can get an STD and everyone can get an STI. And no one is at more risk unless you're not using a condom. Use a condom, you're not at risk. Thank you. No. Don't even need to say anything else about that one. It doesn't affect sensation. Yours or his. Some guys swear that having a foreskin makes them more receptive to sexual pleasure. But there's zero proof suggesting that circumcised dudes are missing out sexually. Huh. Pretty sure that the foreskin, as a baby, it's just a small little thing. It looks small and it's not anything that seems like a big deal. But in an adult man, the amount of skin that is foreskin is covering his penis is the index-sized card. I actually have an index card. So this big. Huge. Huge. Okay? 20,000 feet of nerves are in this index card that they cut off. Now, how on earth can you tell me that 20,000 nerves don't make a difference? And the other part of it is uncircumcised, when they go in, their foreskin pulls back, but when they pull out, it comes back over, thus keeping the liquid in the vagina. Whereas a circumcised man, when he goes in and he comes back out, he's pulling those liquids out with him, and then he's going back in and not pushing that back in because they're going to stay stuck behind the head. So, no. Again, false. They make no sense. All of these articles are ridiculous, but this one was just like beyond, and I just needed to address this. Anyone who reads Women's Health magazine, please do not fall for this bogus stuff. Do your own research. The facts are there. And obviously, there is a reason that it is going down, because more parents are doing the research and finding out that it is a big deal. So, anyways, I just wanted to get into that. I didn't do the actual article that I saw because I couldn't find it again. I think I might have clicked black because it made me so annoyed and I didn't want to read the comments. So I can't actually see that article anymore. But when I typed it into Google, I did find several other articles. So thank you guys for watching. Please do your research. Do not just cut off your son's foreskin because you think it's just a flap of skin, or you think that it puts him at more risk of anything, because it does not. If you care for it properly, which is just simply wiping it like a finger. Like I said, there's a saying, when intact, do not retract. Only clean what is seen. And that is exactly what you do not pull it back. If you pull it back, then yes, I agree, it would give them an increased risk for urinary tract infections. And some doctors don't know that you're not supposed to, so they will encourage you to. But if you do your research and find out, it will retract on its own when they reach puberty. So you never even have to worry about pulling it back and cleaning underneath it. That's the thing that makes me so annoyed, is that people say it's easier to clean. No. How is it easier to clean a wound? Does that make sense? Like, does that make sense? A wound that is in a dirty diaper 24/7? No, that doesn't make sense. This protects from anything. It's not nothing is gonna get in there if you, like, treat it normal. It's gonna be like that. You never have to clean it. It's no extra cleaning. So, not for you anyways. When he's in puberty, then he has to pull it back when he's in the shower. Like, come on. For real. Like, 2 seconds. And it's worth the 20,000 nerves and the index card size skin. So, and then not getting keratinized when he gets older. It's not worth it to do that procedure. There's no reason for it. So do your research. Thanks for watching. Bye.